This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, close to Denver. And my client, Diana, is on her second visit here. She came to see me from Texas. And we worked on increasing hip internal rotation. We worked on increasing hip extension. We restored posterior rotation mobility on both sides of her pelvis per passive spring tests. We did some work on her foot and ankle joints. And I'm now focusing on motion of the sacrum. Now you cannot go by how something looks. So I can look at her sacrum and I wouldn't know by looking at it if there's any motion deficit. I can have her do active movements. That's not going to tell me if there's a restriction of the sacrum. What I need to do is passive motion testing. And so one thing that I'll do is I will isolate the PSISs, okay, which is right here, and then I will evaluate the ligaments below that, and I'm walking across on the long dorsal SI ligament, and then I'm indenting it, and that ligament tone feels fairly normal. I'm going to now find the bottom of the sacrum. So this is the ILA, infralateral angles of the sacrum. And then we draw an oblique line to the ischial tuberosity. And we walk across and strum, and then we find the sacrotuberous ligaments. So I'm on the top of the sacrotuberous ligament, right in the mid portion of it. And I'm trying to spring it forward. And a normal ligament has a little bit of spring and a little bit of recoil. But on both sides it feels like bone. And there is no bone there. Okay, I'm palpating ligament right in here. All right, so the other thing that I'm going to do is I always identify the tailbone because I don't want to thrust on her tailbone. I want to thrust on the lower sacrum. Okay, so I want to be down low at about 4 or 5 sacral segments, 4 or 5. So I'm pushing forward and taking up the motion. Okay, I'm going to do that one more time. So I push down until it stops moving, and then I add a little thrust. Okay, I feel a forward movement and I feel the recoil. Okay, now I'm going to repeat that test, but I'm going to do that at the top of the sacrum. There's no motion available. I cannot take up the slack. So my assumption then is that her sacrum is stuck in counter nutation, although I like the term backward bending. I think it's less confusing. So my goal is to restore forward movement of her sacrum, okay? And if it's stuck in backward bending, that induces a flexion in the lumbosacral junction, okay? So it maintains the sacrum in flexion and it maintains the lowest lumbar segment in flexion as well. And I'll show you on the skeletal model what I'm doing. So, I came to the bottom of the sacrum at about 4 or 5 level, and I loaded it, and then I tested spring mobility, isolated the PSISs, and then came just above those on the top of the sacrum, and I evaluated forward bending motion, and there was no motion available. Okay? There's one other spring test I like to do on the sacrum. I also do others for rotation, for torsions and side bending, and PA glide right in the mid-sacrum, but she has symmetry throughout, and we've already looked at those other spring tests. So this is inferior glide, and she has good inferior glide motion. I see the feet, the heels bob up and down with that, so the motion translates through the SI into the hips, knees, and ankles. So the other thing I want to look at is L5, okay? So I can spring L5. There's good motion there, and there's good motion at 4. Another way of finding that is find the top of the iliac crest, or shelf rather, iliac shelf, and that should be the level of L4, L5, so L5 should be right below that, and I'll double test and that moves well. What I want you to do is step down, and I want you to backward bend a couple of times. I just want you to appreciate the amount of backward bending motion that you have in your low back.
Like that?
Nice, yeah. So do that 3 times. Your thoughts?
Decent.
Okay, alrighty.
Decent, yeah.
So go ahead and lie on your stomach now.
That toe popped again, by the way, with no pain.
And I'm going to put 2 pillows under your chest.
Okay.
So we're putting it up high on the chest, so I want to get some extension in your lumbar spine. And I'm going to lift the head of the table up a little bit to further enhance. So now we've got her in passive extension. I'm going to get a little relaxation in your hamstrings by putting a pillow under your ankles. So lift both feet up and then down. Okay? So what I'm going to do is set a timer for 3 minutes. And I'm going to again isolate the upper sacrum, which is called the base, even though it's the top of the sacrum because it's wider. The sacrum tapers downward like a upside down triangle. So I'm just going to lean onto it with about 15 pounds of force. And I've practiced a lot on bathroom scales, so I'm fairly good at reproducing 15 pounds of pressure. I'll set a timer for 3 minutes. I'll stop filming, and then we'll remove the pillows and we'll retest motion of the upper part of her sacrum, and we'll also have you backward bend and see how that feels. Okay? So I'll stop filming now. We'll come back in 3 minutes and refill.